Hi, everybody. Today I'm here to answer the question, how to create an emergency medical plan for elderly parents. Caregivers really are asking, what do they need to know about emergency room visits for themselves or for elderly parents? So in this video, I'll talk about how to create an emergency medical plan for elderly parents and even yourself and why this is important. If you've never been hospitalized, if you've never been to the hospital emergency room, this is something that you can't even imagine. You may not know what goes on when an elderly parent or really anybody shows up when a health emergency or an accident happens. I'll explain the process and I'll talk about why it's important to have information already on hand when you or an elderly parent goes to the hospital so that you can give this information to the healthcare providers. I'm Pamela D Wilson. My website is PamelaDWilson.com. On there, a lot of helpful information and resources for caregivers, online courses, my podcast, my library, my blog. There's also going to be an upcoming podcast that accompanies this video that will have a lot more detail about all the information that I'm about to share here. So be sure to check back soon. Follow my videos, like this channel, and share this information with other people that you know who are looking for hope, help, and support. So when a person goes to the emergency room, it's usually because of a big event, right? A health condition that's changed, unexpected accident. When you arrive, the staff at the ER have to determine the seriousness of the condition because there's probably a lot of other people there. So they're basically looking at you saying, okay, who gets treated first? They're looking at triage. And so what information do they need from you or your parent? The obvious stuff, simple stuff, right? Insurance information, an ID, a medication list, and a health history, which is important. And this is what we're going to talk about here. But beyond this, the staff at the emergency room need to know what happened or what changed to cause this health condition that brings you to the emergency room today. And also what you or your parents are like when you're feeling good. You may have heard the term baseline. And so emergency room doctors, staff use this term baseline. So what do you normally like if you're healthy, if you're not sick? And so let me ask you a few questions about this whole event, because these are the things that you're going to want to answer. So the reason that you're here, what day, what time did this issue begin? How long did you wait before you came? So if the issue started 2 days ago, did you wait 2 days? If it started 12 hours ago, did you wait 12 hours ago? And what event made you say, you know what? This is pretty serious. I'm not feeling good. I need to go to the emergency room. So the other question is there anything that happened recently that might have caused this change in health? Did you catch a cold 2 weeks ago? Did you travel? Did you eat something differently? Did you stop doing something that you normally do? Pain is another question. So are you experiencing pain in your body? Where? Point to it. And what's the pain level? From 1 to 10, 10 being really, really bad. They're going to want to know what past surgeries and what tests you've had, what health conditions you have, so high blood pressure, diabetes, COPD, and how these affect you day to day. And also, even more importantly, how do you currently take care of your health? So do you attend regular doctor appointments? When was the last time you saw your doctor? What's your diet like? How often do you exercise? Do you sleep well? Your general mood? Any recent falls, accidents, unusual things that you can think of? All of this information is critical because by providing facts and very specific information to that doctor, you actually help the doctor decide how to diagnose this condition and what type of testing needs to be done so that he or she can decide whether they can treat you and send you home or whether you have to be admitted to the hospital for more care. So here's something to consider also. If your elderly parent is going to the emergency room where you're going, are you driving yourself or are you calling 911? Are you calling the ambulance? Regardless, it's important that if you're the family caregiver, you show up to the emergency room to be able to help your parent answer all these questions for the doctor. Because honestly, if you've ever been in the hospital, you're not feeling well. You may not be thinking right. You may be delirious. You may not be able to give accurate information to that physician, but that is exactly what's needed to get the treatment that you want. So it's important if you have a loved one that you actually show up at the emergency room. Also, things to do. It's very important to have a typed list or a packet in the home of your parents with copies of IDs, insurance cards, their current medication list, health diagnosis list of doctors, when you've last seen the doctors, and now. So if your parent isn't computer literate and they can't create this, this is something that you as the caregiver will want to do so that you also have a copy, so that if you ever have to print it off and go to the hospital to meet them, you have the information. So in my other videos, I also talk about the importance of creating legal documents to appoint somebody to act for you or your parent as an agent. So medical power of attorney, financial power of attorney, a living will. The hospital's going to ask if you have all of this information. And so if it's the first time you're going, it would be great to have a copy to give to them. If not, you can always follow up to do it. And if you haven't done it, it's very important to follow up to get all of this done. Because at some point in life, we all may experience a trip to the hospital emergency room, whether it's because we had a skiing accident or a biking accident or something, or a health problem. So just like you prepare for the unexpected with car insurance and renter's insurance and homeowner's insurance, preparing for unexpected health issues by having this information available, by creating this information, is going to make planning ahead for an emergency less of an issue, because when you go to the hospital emergency room, you're going to have all the information you need to get really good care for your parent. I'm Pamela D Wilson. Please visit my website, PamelaDWilson.com. So much helpful information for caregivers and aging adults there. Please please share these videos on my YouTube channel. They offer very practical information for caregivers and aging adults that can benefit everyone. Have a fabulous day today. I'll see you all again soon in another video.